The data shows that approximately 1 in 4 individuals in Wisconsin suffer from mental health and behavioral health issues. So it's evident that the HW Endowment should invest resources to support our communities in the hurdle of overcoming these issues.
The way that this grant has been different than the other grants that I've ever worked on before is that they, meaning the partnership and everybody else in this coalition, took a year to plan what their goals and objectives were. And that's very unlike any other grant that I've ever worked in. Typically, I come in a grant and they say, this is what we want to happen, and we implement it, and then we look at the outcomes. So the broadness of this grant is that we have 5 counties that we work with. Each of those counties is very different in their needs and what their strengths are. And so the partnerships that we have made are from various, very diverse groups across those 5 counties. We have law enforcement, librarians, public health officials that we work with, community members with lived experience.
At the HW Endowment, we knew that the complexities of tackling behavioral health in these communities was beyond any one organization to tackle on their own. Thus, the importance of coalition building in communities so that a group of organizations, along with systems within that community, could tackle these issues together.
So Southwest CAP represents 5 Southwestern counties: Iowa, Lafayette, Richland, Grant, and Greene counties. And our population is all adults for the focus of this project, because everybody needs access to care.
One of the biggest barriers that we have of improving mental health in Southwest Wisconsin is that nobody wants to talk about it. There is a lot of stigma around discussing mental health. And so one of our goals at the Behavioral Health Partnership is to reduce that stigma by normalizing talking about mental health. Another thing that we're doing is we are building up the capacity of neighbors helping neighbors.
We saw in Southwestern Wisconsin where there's a big issue with stigma and a big issue with the farm population, which I believe at the time what we learned is that farmer suicide rate in America was double the veteran suicide rate. And in this region, farmers were very reluctant to get involved with social services. And they had built relationships with people and done community building and learned the folks that people trusted in that community, the kinds of professions like the seed dealers, the mechanics, and folks like that. And they trained them in mental health first aid to reach out. And just a great example of really innovative, thoughtful community building to solve problems.
We were originally hoping to get providers to work at the top of their licenses and to get primary care providers to incorporate behavioral health screenings and treatment into their care. And we had a lot of trouble with that. So we ended up doing something I think was pretty innovative and that came out of the coalition, which was to actually train community members to recognize distress in their friends, neighbors, and family members, and to have skills to negotiate conversations with them around that.
We have 3 goals. We have 3 work groups. They are working on normalizing talking about mental health. We are building up common language for people to use around mental health and behavioral health. We are building up the capacity of community members. So we are doing trainings like Comment and Safe Talk so that people have language and questions to ask. And then the 3rd thing that we're doing is that we are trying to improve navigating systems of mental health. We use the network of care in Southwest Wisconsin. So it's an enormous resource hub for anybody in the area to get on and type in any topic that they want. And they can get names of people they can go see, or they can get articles to read.
We've been led by people with lived experience who have created workshops about Don't Mask Your Emotions, which was about being able to talk about your anxiety around COVID, and a program called The Water We Swim In, where people come together and talk about the cultural prohibitions that they've learned growing up, recognizing and being able to identify their own emotions. Because before you can identify stigma and tackle stigma, we realized we had to take a step back and recognize the self-stigma in the community and the ways that people had learned a kind of Midwestern stoicism and had prohibited themselves from even identifying their own emotions. So that's been a big step for us. The results-based accountability process itself has been really amazing. I think even for a lot of us who have worked in this field for a long time, this was a much more systematic way of starting with the ends in mind and really thinking about the structures, backing up into the structures that hold the problem in place and trying to figure out how do you shift those and what are the levers that will move those, and sort of bringing those to the community and getting people to think. I mean, it's very capacity building to getting people to think not just about what they can do in the moment, but what really would have to happen to move the problem in a big way. And maybe we can't do all those things, but then at least you can identify what's feasible and what will work.
Our hope is that the resources and the capacities that have been built within the backbone organizations in each community, as well as those coalitions, will strengthen the communities and enable behavioral health strategies to live on.
When I think about how people even talked about mental health and how people even talked about themselves 5 years ago, you can see an enormous change, and that will never go away.